Cornelius. I'm Director of Care here at Livingston Lodge, and I've been in nursing since 1981, which is a long time, and I've done lots of nursing, majority with seniors.
Okay, so today I'm here to talk to you about dementia.
Okay.
So to start off, how does dementia usually affect a person?
At the beginning stages of dementia, they try and hide it because they are aware that things are different. We all misplace keys and, letter openers and all that stuff. They do it on a continuous basis, or they're driving and all of a sudden they're not quite sure where they are. So at the beginning stages, stage 1, they're aware. Families are noticing that there's some differences, but everybody kind of hides it because they don't want it brought out into the public per se. As they get close to, the middle stages of dementia, they could look in a mirror and not realize who they are, and then they become really freaked out because there's a strange person in their apartment, in their house, that they have no idea who they are. End stages, they can really be considered palliative. They're bad. They hardly eat, if they eat at all. So it's a horrible, horrible disease.
So what do you do when trying to manage an irritated dementia patient?
Right now, it's really important just to keep them calm. Don't startle them because that really upsets them. Somebody comes behind them and they say hi. They can't deal with that. What you need to do is keep them calm. Way back when I started, they used to do what was called reality orientation. If they said today was Thursday, we would say, no, today's Friday, October 30th, blah, blah, blah. You don't do that anymore. Because if they go back to where their husband has died, you bring them forward to where it's supposed to be today, then they go back again and again, they're mourning the death of their husband. So you keep them calm, you listen. That's about all you have to do. And if they're grieving the loss of their husband, then you let them do that. Or their children, whatever the case may be. Just be gentle.
Okay. How has dementia affected their day-to-day lives, would you say?
Again, it depends on where their stage is. Early dementia, again, they can pretty well cope. They cover up a little bit. And stage 2, it's the same. Family is more aware. You have to be careful of what we call exit seekers. So they would need to be really in a protective environment, because if they run away, they can not know where they're coming from. They can be accosted by strangers. They could be abused, things stolen from them, and then they really don't know where they live. So where they're staying would depend on the stages of the dementia, what care needs they need, that kind of thing.
Okay. So how does a patient with dementia affect your relationship with them?
It really shouldn't. You're going to have to get to know that person so that you can then decide what their needs need to be met. Today there's some really good medications out there that can help. If it's caught in the early stages, it can plateau a little bit.
Oh yeah?
There's Aricept, Exelon, medication, or medication patches. There's all kinds out there that can help them, and then your relationship isn't affected so much. I think it's difficult for families, because if it's your partner and you're planning, once retirement comes, to travel the world, and then they've been diagnosed with dementia, that's going to be a little difficult to do. So I always tell people, spend your money now. Go on vacations now. Don't wait till you retire. Get treatment very, very early, and then let them direct you into the relationship.
Okay, so with all your years in working with old age, would you say that dementia is becoming more and more of a problem?
It is, because people are living longer. And as a result of living longer, dementia does set in. It is senior dementia, but what's really sad is that there is dementia that can start as early as 30 years old.
Oh.
It tends to come in families. There's gene there that, if one of your family members, if one of your parents has early Alzheimer's, early dementia, find out if you have the gene, because it can really affect you that way as well.
Oh, yeah.
And this is just my personal opinion, but I don't think seniors are respected as much as they need to. There's lots of research for cancer, and we're very supportive of that, having cancer in the family. But we don't do a lot of research regarding dementia, regarding Alzheimer's.
That's true.
And what does that say about our senior population?
Yeah.
They've been through wars. We're here today because of our senior population. They've given us a really good life, and we're just saying, oh, well, you've got dementia, that's life. Sorry. They need to put some more research dollars into exploring dementia, finding some medications, finding how we can prevent that, all that stuff. So.
Yes, I agree. So is there something that you personally go about when dealing with patients with dementia?
What I want to do with people with dementia is keep them relaxed and happy. Yes, they're not going to be able to be happy all the time. None of us are. But what's really important is that I respect who they are, find out how they are. If I notice changes, or different staff members come and tell me different stages, it's important to talk to the doctor. Because maybe we need to increase the medication, maybe we need to change the medication. Sometimes things as diet, getting out, doing some exercise, walking, things that we all take for granted. It always happens, with people with dementia.
By doing those small things, would you say that it sort of like lessens the patient with dementia, like from them feeling like aggravated or irritated?
Yeah, for sure. You're also going to have to educate the family.
Oh, yeah?
Because it's hard on family. We have a resident here who's got 3 sons, but she doesn't remember 2, but she remembers 1 because he looks like her husband.
Oh.
Her husband died a few years ago. So she latches on to him. She doesn't recognize her grandkids. That's hard for the family. So they came in really upset, and I had to sit down and talk to them as to what they were doing, what things meant, how things were changed, that kind of stuff.
Okay.